Okay, so you got blood in your eye. You're thinking, is this a big deal? Should I go see somebody? What is the deal? Welcome to Talking with Docs. I'm Dr. Brad Weaning.
I'm Dr. Paul Zalzal.
We brought a specialist in, an eye surgeon, Dr. Rajiv Bindlish, to talk all about this. Thanks for coming back.
Thank you.
People are loving your video about dry eyes. It's for the moon. Like 500,000 people already watched it.
I'm glad if it helps, because it helps us by making us more available for people who have significant eye problems. So
We love it. We love it.
So tell me, what are you talking about, Brad? Blood in the, like I splash blood in my eye, you mean?
No, not in the OR. Okay. I mean, like if someone looks in your eye, they're like, bro, you got blood in your eye. And there's probably two main reasons that this happens. Can you break it down for us?
So number one, it's pretty rare to splash blood in your eye, okay? And if you do, tells you, maybe you got to wonder about that surgeon or what kind of protection he's wearing.
Right.
But anyway.
Or you're a serial killer.
Or you're a serial killer, exactly. But, being very commonly, people get something called a subconjunctival hemorrhage, and that is kind of a red spot on the white part of the eye.
Right.
Most common cause is a little bit of localized trauma. You might have poked yourself in the eye. If you were coughing or sneezing, you're unwell, or you take a blood thinner. Some of those are reasons why. It's the skin of the eye is a little bit fragile, and the blood vessels are very fragile, and it can break. There is no treatment for a subconjunctival hemorrhage. The only time we get really, really concerned about a subconjunctival hemorrhage is somebody gets a really, really bad one, and the skin of the eye is quite swollen, and you're having difficulty closing your eye.
Oh, wow.
If that happens, then we just got to be a little bit more careful. We want to make sure you lubricate your eye so the surface of the eye doesn't dry out. Majority of the time, within 7 to 10 days, they clear. Again, there's no treatments. Sometimes you may need an adjustment of your blood thinner if you're on some heavy doses. Very rarely, very, very, very rarely, you could have a retroorbital tumor that could cause a subconjunctival hemorrhage. This is like probably 1 in a million, but it can happen. Generally, in those situations, there will be other symptoms as well.
But it looks quite shocking to people.
It does.
And it'll go through the normal bruising phase where it'll turn like yellow, and then your body just kind of clears.
Yeah, like the eye won't as much turn yellow. If it tracks into the skin around the eye, then it will turn yellow. But again, if you got a good punch to the eyes, if you had a good night, the bar was busy, and you had a little bit of trouble with somebody, a punch to the eye, that's a different cause for subconjunctival hemorrhage.
What circles you're running in? Sheesh.
She's gonna go to the bar.
I hang around Paul a little too much.
That's right. Too much Zalzal. Okay, so that's the more benign version. Okay, what about when you actually have blood like deep inside of your eye?
So generally, blood inside your eye, there's a few different causes. So the most common is eye trauma, so blunt trauma to the eye. If you were playing a sport, somebody elbowed you in the eye, or you got a fist to the eye, or you're playing a racket sport, a tennis ball,
pickleball,
yeah.
Sheesh.
So that's called a hyphema, and that actually is an emergency, and that is something we would like to diagnose and treat. Number one, it can recur if you don't take care of it. So we generally put people on bed rest, avoid aspirin type medication, and it could lead to problems in the eyes, blood staining of the cornea. It could put you at risk of glaucoma. It could put you at risk of a retinal detachment. So we do take blood inside the eye quite seriously.
So how can I tell the difference if I've got a red eye? Is this on the outside, or is it subconjunctival? Is it in the eye?
Yeah, so subconjunctival will be in the eye, or on the surface of the eye. So the white part of the eye will look red.
Okay, what about your hyphema?
You mean generally it'd be after an injury.
Right, and you wouldn't necessarily see it, but your vision, you might have some vision loss.
Blurry. Your vision would be blurry.
So with the subconjunctival hemorrhage, you don't really have any vision changes, but with the hyphema, now you've got some vision changes.
And with the hyphema, it's typically in the anterior chamber. Is that right? So location-wise, if you can let our viewers know, kind of, if we're going from front to back, the structures in our eye and where that blood's living.
Yeah, so there's a little gap between the cornea and the lens of the eye. We call that the anterior chamber. That's where a hyphema is, and it's usually because the iris, which has a blood supply and an attachment to the eye, there's a usual break in that area, and that's what causes the bleeding in the eye. But again, it takes spontaneous hyphema is very rare.
Right.
Generally, with a hyphema, it's after significant eye trauma.
Okay, so you go to, it's emergency, you have visual loss, so you go to the emergency room, they say, yeah, you got a hyphema, they look in your eye, they call you.
Yeah.
What are we gonna do? Tell me you're not putting a needle in the eye to drain the blood out of the
Generally,
eye.
we don't drain it.
Okay.
Sometimes we have to if there's a lot of blood in the eye.
Because of pressure?
Because of pressure, the eye pressure is elevated. We generally give it a few days to clear.
Okay.
Generally, we put you on bed rest, we put you on some eye drops, and we ask you to avoid any sort of aspirin or aspirin-like products because that can contribute to more bleeding.
And if you're on a blood thinner, maybe you would dial that or hold it or whatever, depending on the reason.
Exactly. And then generally we just watch it, and majority of the time it clears, and majority of the time it doesn't cause a consequence. Long term, it can lead to what we call traumatic glaucoma, and so sometimes over your lifetime, you may just need your eye checked out in a regular screening just to make sure that doesn't happen.
I think we have a video on glaucoma too.
Yeah, we do, that you did.
Thank you.
And this is why when you're playing racket sports, especially with the popularity of pickleball, you should consider getting eye protection, right?
Exactly. Pickleball and badminton. I mean, I'm seeing a
Yeah.
lot of injuries in both sports. I mean, the ball fits perfectly right in the orbit. So, I mean, any type of sport nowadays, you probably should be wearing some level of eye protection.
Have you seen the pickleball glasses?
No.
What's interesting, they're called kitchen blockers, and actually it's just the frame. A lot of them don't have lenses because the frame itself is the size of the ball, so it prevents. So you don't even have to wear glasses.
Is it the ball or the racket that's hitting you?
It's the ball, I think, that's hitting
I
you
thought
in
the
the eye.
racket too. And
Well, I guess if you got a racket in the eye, that would be hard. Maybe you should wear a helmet then. I don't think the glasses are going to help.
Yeah, but it's all sports too.
Yeah.
I mean, I've seen it in golf balls to the eye. I've seen basketball, the elbows to the eye. So,
Imagine if you got a golf ball.
It's got a hole
yeah,
in
well,
one.
it's pretty bad.
eye.
Real hole in one.
Yeah.
It's got a hole in one of my eyes.
Leave a comment if you've had some type of eye trauma or had a hemorrhage in your eye and you're worried about it and you have some questions or had an experience that you want to share. And if you like this video, please like it, subscribe to our channel, share it with someone who maybe needs to wear kitchen blockers when they're playing pickleball.
Remember, you are in charge of your own health.
Thanks, Raj. Thanks for coming again.
It's a pleasure.
We'll see you next time.